Driving is now a big part of Alison McVinney's daily routine. After her husband, Kevin Crozier, had a massive stroke in February, she followed him as he bounced back and forth between Ontario hospitals, from a specialized stroke centre in Toronto to a facility closer to their home, north of Barrie.
You're completely helpless. You're potentially going to have your spouse who can't communicate well, who's really hurt, get moved somewhere and potentially not see him again. Here's a skiing.
The 54-year-old architect and avid skier has been Alison's partner for the last 30 years and father to their kids. She thought his third transfer to a hospital in Barrie would be his last. Then came the pressure of rising COVID-19 admissions.
You could just feel the vibe and the energy changing, and things were getting stressful and decisions were being made. And then I got a phone call saying, we are planning to start the transfer.
Kevin was sent to yet another facility in Orillia, his fourth move in 2 months.
COVID has its own path that's so destructive, but then now what it's doing is it's displacing all the people that need all the other important things. And, it's kind of lessening their importance. And now I worry that he's kind of lost interest in things because he's just moved from place to place.
How does that make you feel?
Sad, terrible, and all I want to do is encourage him all day.
At the Barrie Hospital where Kevin stayed before his latest transfer, they've had to build a field hospital and sent out 100 patients to make room for the 200 who've arrived from Toronto. Dr. Chris Martin heads up the critical care team.
Moving them patient, an hour up the road or sometimes across the entire province to get care, that distance is very tough on families, and that's the biggest stress. The other stress is to the staff too, who feel the families' anxiety and their fear, the patient's fear as well as being moved further away from their family. So it's stressful all around.
Radhika Gandhi knows that feeling well. Her father, Naomi Gandhi, was infected with COVID-19 late last year during an outbreak at the factory where he worked.
One of the things I was so grateful for that in Brampton Civic Hospital, there was a doctor that spoke my dad's mother tongue, and they were able to speak to him in Gujarati before putting him on the ventilator.
But the family soon learned the hospital needed to free up beds and planned to transfer him.
How much did that play into your family's stress level, too, on top of everything else that was going on?
Quite a lot. It was a lot. The reason they said they're transferring him is that he's the most stable out of all ICU patients. So we were kind of just like, is this going to impact his progress, the way that he's doing?
Kanea had always been a source of joy for the family, a boisterous man who adored his wife and 2 daughters, and worked tirelessly to make sure he could provide an education for his kids.
These are 2 of his rings that I wear around my neck. He wore these every day.
Kanea passed away on February 4th at the age of 58. Only Radhika was by his side. The experience left her with questions.
In the weeks following his transfer, he got a lot of secondary infections. So that really made me wonder, was it because of his transfer? There's no evidence leading to that, saying that the transfer did anything, but you can only help but wonder.
Orange paramedic Naomi Williams has been shuttling patients around the province for months. But even she says she'd never want that kind of transfer for her own family members.
I've never done it where we're transferring patients just because of bed availability so much farther away from their family. So I can't even imagine how horrible that would be.
Each transfer can take hours, filled with perilous moments where Williams is alone in the back of the ambulance, watching for any bump in the road that could disturb a fragile patient. She now transports more critically ill patients in a single day than she used to in an entire month.
I've transported lots of people that are younger than myself, but usually it's a trauma or it's kind of a one-off. It's certainly never in my career have I transported so many people that are essentially just, they're sick from a communicable disease. So it's taxing, it's hard to watch.
So we so excited about the apples because Kevin's big thing is apple crisp.
Alison and Kevin moved to this rural property last fall to start a new adventure. Instead, they're stuck an hour apart.
we have to get back to families being with their family in these situations. And I can't imagine there won't be people looking back at this and thinking, how many people did we lose because the recovery got sidetracked and their families couldn't be there?
Now she's just hoping Kevin gets to come back home.
Okay, so Lauren, do we have an update? How is Allison's husband doing now since you met her for that story?
Yeah, well, Kevin's getting a little bit better day by day, and she is still going in to visit him, helping him try and rebuild some of his communication skills.
And I understand you asked provincial officials about the emotional toll on families and frontline healthcare workers. How did those officials respond?
Well, Ontario's Ministry of Health said they're aware that the situation is distressing for anyone using a hospital and that they've made investments into boosting capacity, but that this was an unprecedented strain on the healthcare system. Now, we do know that ICU admissions in Ontario are starting to go down now, so there is hope that these patient transfers might not be needed too much longer.
Okay.
Andrew?
Lauren Pelley, thank you.